Welcome to The Explainer. Today, we're tackling a massive challenge in veterinary medicine and really the global agricultural economy. We're talking about mastitis. Now, this isn't just a simple everyday infection. It's an economically devastating, incredibly complex disease that targets the mammary glands of dairy animals. It literally changes the composition of the milk they produce and presents a massive headache for farmers and veterinarians alike. So in this explainer, we're going to unpack the microscopic warfare happening right inside the udder, the drastic clinical signs, and the rigorous science we use to fight back. Let's get into it.
Okay, let's dive into this. Here is our roadmap for today. We'll cover the threat of mastitis, how the infection spreads, recognizing the symptoms, detecting the disease, and finally, treatment and prevention.
So, Part 1, the threat of mastitis, a zoonotic and economic crisis.
To really ground our understanding, let's look at the textbook definition. The word itself actually comes from the Greek mastos, meaning breast, and itis, meaning inflammation. But biologically speaking, it's a complex disease that results from a really intricate interplay between infectious agents, a farmer's management practices, and environmental factors. You see, when a cow contracts mastitis, it doesn't just cause swelling. It fundamentally alters the physical, the chemical, and the microbiological makeup of the milk itself, and that goes alongside some severe pathological changes to the mammary glandular tissue. To understand the scale of this problem, consider this. There is a 10 to 12% risk of mastitis occurring in individual herds. I mean, that is a staggering prevalence, especially when we're looking at high-yielding dairy animals like exotic and crossbreed cows. And the economic loss tied to that number, it's immense. We're talking about a drastic reduction in milk yield, total degradation of milk quality, and the forced culling or removal of chronically infected cows from the herd. It's a huge financial hit. So who exactly is to blame here? Well, the microscopic culprits are surprisingly diverse. The main bacterial invaders you'll see are Staphylococcus aureus and Streptococcus agalactiae. But they are far from alone. We also see soil-borne pathogens like E. coli and Pseudomonas, and dangerous organisms like Corynebacterium pyogenes, which actually causes something known as summer mastitis. And, it's not just bacteria either. Fungi and yeasts like Trichophyton and Candida can invade as well. What's really interesting is that while viruses, like foot and mouth disease, don't cause mastitis directly, they damage the tissues and essentially roll out the red carpet, practically inviting these bacterial and fungal invaders right in.
Moving on to Part 2, how the infection spreads, breaking the defenses. I want you to imagine the cow's udder as a highly fortified castle. How exactly do these microscopic invaders breach the defenses? The variety of ways a cow can catch mastitis is honestly quite surprising. The most common breach happens right at the teat canal, often transmitted simply through the unwashed hands of a milker moving from an infected cow to a totally healthy one. But the environment plays a massive role too. Think sharp objects causing physical trauma, contaminated bedding, or even biting flies introducing bacteria. Some forms are even more insidious. For example, tuberculous mastitis is hematogenous. That means the bacteria travel directly through the animal's bloodstream to set up shop in the udder. And get this. Pathogens like mycoplasma can literally be inhaled into the respiratory tract before making their way all the way down to the mammary tissue. Crazy, right?
Let's move to and see how this builds. The pathogenesis, or how the disease actually develops, follows a very logical three-step progression. Step 1 is invasion, where organisms successfully pass from the outside environment through the teat orifice and into the teat canal. Step 2 is infection. Once they're inside, they multiply rapidly, invading the deeper mammary tissue. And finally, Step 3 is inflammation. This is where the cow's immune system kicks in, leading to massive infiltrations of white blood cells and that physical swelling that really characterizes the disease.
All right, Part 3, recognizing the symptoms, from bad to worse. In a peracute infection, the disease hits incredibly fast. Systemically, the cow can spike a severe fever, up to 107 degrees Fahrenheit. She stops eating, and milk production drops instantly. Meanwhile, locally, the udder becomes hot, swollen, and secretes this watery, blood-stained fluid. Acute mastitis is similar but slightly less intense, often producing thick, yellow, pus-like milk. Chronic mastitis, though, that is a whole different story. The systemic fever is totally absent, but locally, the healthy memory cells are permanently replaced by fibrous scar tissue. That leaves the udder hard, shrunken, and filled with palpable nodules. But it actually gets worse. I want to share a couple of extreme variations just to reinforce the absolute high stakes of proper animal care here. Summer mastitis, which is driven by Corynebacterium pyogenes, leads to foul-smelling abscesses that can literally break open. It carries a devastating 50% mortality rate. And even more shocking is gangrenous mastitis, caused by Staphylococcus aureus. This causes thrombosis of the veins, leading to local congestion that's so severe the skin turns blue, goes cold, and the affected quarter of the udder literally sloughs off piece by piece. It is absolutely brutal.
Which brings us to part 4, detecting the disease, the detective work. So I want you to think about this. When the signs are subclinical, meaning the animal looks completely fine to the naked eye, how do we spot an invisible bacterial threat before it quietly spreads and destroys an entire herd? Well, the answer lies in some truly fascinating clinical and chemical tools. Now, what's really interesting about this slide is the stark, high-contrast chemical shift that happens when mastitis takes hold. Normal milk is white, smooth, and sits at a slightly acidic to neutral pH of about 6.4 to 6.8. But mastitic milk, it undergoes a dramatic chemical transformation. Because of the infection, it becomes highly alkaline, rocketing to a pH of 7.4 or even higher. Visually, it might turn yellow, get blood-tinged, or take on a watery or even a cheese-like consistency filled with visible flakes and clots. You definitely wouldn't want to drink it.
To detect these invisible changes early on, dairy farmers use chemical diagnostics. The gold standard field test is the California Mastitis test, or CMT. When you mix the CMT reagent with mastitic milk, a really fascinating reaction occurs. The anionic detergent in the reagent actually reacts with the DNA present in the massive number of immune leukocytes that are actively fighting the infection. This instantly forms a thick, visible gel. The thicker the gel, the higher the cell count, and the more severe the subclinical mastitis is. It's a brilliant piece of on-the-spot chemistry.
But when field tests just aren't enough, we transition to high-tech laboratory diagnostics. This includes electrical conductivity tests, which measure the increased sodium and chloride ions in infected milk. There are also incredibly precise automatic somatic cell counters that use a chemical called ethidium bromide to literally illuminate and count the DNA of somatic cells via fluorescence. Veterinarians can also perform microscopic examinations of stained milk smears. This lets them visually identify the exact bacteria, leukocytes, and tissue macrophages present, providing a highly targeted diagnosis. Finally, part 5, treatment and prevention, defeating the disease. The medical response to a mastitis outbreak has to be fast. First, the infected quarter is frequently stripped of milk to physically remove toxins. Next, veterinarians deploy a dual attack: local intramammary antibiotics and systemic injections, alongside medications to bring down those massive fevers we talked about. But here's the catch. If diagnostics show the infection is actually fungal, all those antibiotics are completely useless. The vet has to pivot entirely to antifungal drugs, like nystatin, to avoid making the whole situation much worse. So the crucial point is that despite all these advanced interventions, sometimes the treatment just simply fails. This is especially true with chronic fibrosis or super stubborn pathogens like Pseudomonas. When cases become incurable, farmers are forced to make some incredibly tough economic decisions. They might have to infuse harsh chemicals like 3% silver nitrate to intentionally and permanently destroy the affected quarter's milk-producing ability, effectively drying it off. And if multiple quarters are involved, the only option is culling the animal entirely to protect the greater good of the herd. Because the consequences of failure are so high here, prevention is infinitely more valuable than treatment. And one fascinating, completely zero-cost management tool is simply enforcing a strict milking order. It goes like this. You start by milking your youngest, healthiest cows in their first and second lactations. Then you move on to the older, healthy cows. You always milk the infected or recovering cows dead last. This creates a physical, chronological barrier that stops the bacteria on a milker's hands or equipment from traveling down the line to the healthy animals. It's so simple, but so effective. But you really need a comprehensive defensive strategy. The ultimate preventative measures involve a highly proactive approach. We're talking routine teat dipping in antiseptics like iodo-4 immediately after milking to seal that teat canal. A massive game changer is something called dry cow therapy. This is where long-acting antibiotics are infused into the udder right when the cow enters her non-milking rest period, clearing out any hidden infections way before the next calving cycle. Environmental tweaks are absolutely vital too, like swapping out organic sawdust bedding, which just breeds bacteria, for inorganic sand. And this brilliantly illustrates a key takeaway. You can have access to the most sophisticated DNA-targeting diagnostic machines and the absolute most powerful modern antibiotics on Earth, but this simple quote from the literature rings true. Good hygienic measures are very important as the disease is commonly seen in poor hygienic conditions. At the end of the day, basic, meticulous cleanliness,
Washing hands, cleaning barns, isolating sick animals remains the single most powerful weapon we have in this fight. We've seen the devastating economic toll, the brutal clinical signs, and the rigorous scientific fight against this disease. But as pathogens naturally build resistance to our antibiotics, and as dairy demands continue to scale globally, it leaves us with a lingering thought. With microscopic invaders constantly evolving, will science and pristine hygiene ever truly be enough to fully eradicate mastitis from the global dairy industry? Or is this just a permanent, never-ending biological arms race? Thank you for exploring this fascinating topic with us today, and keep asking the big questions.